Hello, I'm Dr. Pedram Keshavarz from the Department of Interventional Radiology of New Hospitals in Tbilisi, Georgia. Today, I want to talk about depression and anxiety during the COVID-19 pandemics. And the title of my talk is about depression and anxiety among pregnant mothers in the initial stage of COVID-19 pandemics in the southwest of Iran. So, what do you think about the effects of infectious disease pandemics such as COVID-19 on psychological stress in pregnant mothers? So let me just start by giving you a couple of numbers. In late December 2019, COVID-19 was reported by Chinese healthcare facilities in Wuhan, China. On March 11, 2020, WHO declared COVID-19 as a global pandemic. Since December 2020, various vaccines produced and taken FDA or WHO approval. Until December 4, 2021, more than 198 million people have fully vaccinated and around 45 million received a booster dose. Until December 3, 2021, more than 263 million people were infected and more than 5 million people unfortunately died due to this pandemic. Based on an interesting Nature report, the amount of data that has been generated is simply mind-blowing. More than 250,000 studies were published about COVID-19 in 2020, and more than 3,000 COVID-19 articles were preprints. It means around 4% of the world's research output was devoted to the COVID-19 in 2020. So, back to our question. Effects of COVID-19 on psychological distress in pregnant mothers. We know from the previous outbreaks such as SARS revealed remarkable impacts on psychological distress, including depression and anxiety in pregnant mothers. On the other hand, children of mothers who experience high psychological distress during pregnancy are more likely to have cognitive and behavioral problems, and also their communication skills are significantly affected. Our study is cross-sectional. We conducted all pregnant mothers registered in our maturity. After the participants were reminded of their rights, we asked to complete an online questionnaire. Pregnant mothers were excluded from the study if they didn't answer their phone 3 times, they were reluctant to participate, and if they had not been living in a city for at least 6 months prior to the study. This is the flow chart of the study. As you see, 920 pregnant mothers were called, and finally 440 pregnant mothers completed the questionnaire. We had 3 main parts of data gathering: 1. Sociodemographic, 2. Obstetric and medical history, 3. The short form of the depression and anxiety stress scales, or DASS-21. In the first part, sociodemographic, we collected data about the participants' age, marriage duration, residential area city or village around city, educational level, employment status, insurance status, and also self-reported socioeconomic status, or SES. In the second part, obstetric or medical history, we collected data about gestational age, number of pregnancies, including the current one, any maternal comorbidities, and medication history, including the supplements. In the third part, depression and anxiety stress scales, or DASS-21, in this questionnaire consists of 21 questions, 7 in each subscale of depression, DASS-D, and anxiety, A, and stress, or DASS-S. Each subscale score ranged from 0 to 21, with higher scores representing the respondents' higher depression and anxiety and stress levels. The majority of mothers had no comorbidity, while 59 mothers, around 10% of our study included, had one comorbidity. The first two most common comorbidities were hypothyroidism, 7.8%, and diabetes mellitus or gestational diabetes, 5.7%. We found that having an above normal DAS-D score or depression score was significantly associated with the pregnant mother's insurance status and self-related health levels. We observed an abnormal depression score was significantly higher in pregnant mothers who had no insurance. Additionally, an abnormal depression score was more prevalent among pregnant mothers who reported poor health status compared with those who reported good or intermediate self-related health levels. Also, according to the logistic regression analysis, pregnant mothers who did not have insurance had a 2.5 times higher chance of having an abnormal depression score. This is so interesting. So we found that having a DASSA or an anxiety score was significantly associated with the pregnant mother's job status, educational level, self-related health, and also the number of comorbidities. Our results indicates that abnormal anxiety score was more prevalent among employed mothers and those with the university degree. So, mothers who reported their health status as poor had the highest frequency, around 30% of abnormal anxiety score, compared with those reporting an intermediate or good self-related health. When we are talking about pregnancy, we are talking about the significant transition period in woman's life. And during this period, many physiologic and immunologic changes occur. Psychiatric disorders such as depression and anxiety during pregnancy have been associated with many complications like preeclampsia, diabetes, premature birth, low birth weight, and postnatal complications. Overall, we found that COVID-19 pandemic may contribute to a significant increase in depressive and anxiety symptoms. And our results revealed that pregnant women reported abnormal depression and anxiety levels in the initial stage of the COVID-19 pandemic. Thank you, and I will be more than happy to take your questions by email.